Let's study something until you become a neonatologist. All right, this one is a newborn infant that you're called to evaluate because of a rash. And when the baby comes down, this is what you see. You can see there's this almost like vesicular or pustular rash on the inside of the arm and into the armpit. And the diagnosis is incontinentia pigmenti, or IP, since that's kind of hard to pronounce. And if you're thinking of something like HSV, that should definitely be in your differential, but what is separating this type of rash from HSV is the distribution. So the distribution of this rash is along the lines of Blaschko. And the lines of Blaschko, actually everyone has, we just can't see it. It is they think that it represents the pathways of epidermal cell migration and proliferation during fetal development. There are certain rashes or skin conditions that appear along the lines of Blaschko. This is just a picture of someone's back that has a rash on it that is following that distribution. So getting back to IP, it is an X-linked dominant disorder, so you will see it predominantly in females. Rarely you can see it in Klinefelters, which is XXY. Typically, if a male fetus does inherit it, the pregnancy will end in miscarriage. There are 4 stages of IP. Stage 1 is vesicular, stage 2 is verrucous, stage 3 is hyperpigmented, and stage 4 is hypopigmented or atrophic. You can also have involvement of the eyes and the brain. So infants that have this should be seen by an ophthalmologist as well as a neurologist because they have an increased risk of seizures. And the rash typically presents at birth or within the first 2 weeks of life, and the rash can actually persist from 2 weeks to 4 months. You'll typically see the lesions on the trunk or the arms, and most of the time the lesions will disappear at 8 months, but they can come back at any time, particularly in febrile illnesses. Prognosis varies, so depending on the severity of IP, the prognosis can be fine. If there is CNS involvement or eye involvement, typically there is a lot more difficulties as time goes on for that baby.